We have an effort around Watson for Oncology, which is looking at helping support oncologists at the point of care to address the challenges in cancer care. And we also announced a partnership with the American Cancer Society that's focused on creating a patient advisor for people with cancer and survivors. I would say there's some similarities, and what would they be? They're typically about this challenge of big data, knowledge in the medical record, knowledge in a journal, knowledge in textbooks, and this reality that it's humanly impossible for anybody to know everything about every situation and keep up with the literature. So it is about that consistent theme of translating data into an insight and into a personalized solution to the key stakeholder, customized, whether it's a patient or provider. I think every situation and every condition is unique and has unique challenges. And so when we look at diabetes care and prevention, there is it's such an epidemic. And frankly, it's what, as was referenced, it's an invisible disease that we believe the data can help bring more visibility to it. We believe that the data will help us better predict those who will get the disease, diabetes or prediabetes, and predict those who may be more likely to evolve to the bad consequences of the disease, like blindness, kidney failure, amputations, and heart attacks and strokes. We also think you need to personalize those interventions, because one thing that we have not been as effective at times in healthcare is to realize that each of us as individuals have unique aspects of what could be effective in terms of the nudges that could work. And so that is important, personalization. And then the other thing is we ultimately need to demonstrate impact on preventing bad health outcomes and also promoting health and wellness. This is not just about preventing disease complications or consequences. It is about promoting health more holistically and realizing a condition like diabetes has components that are mental, that are social, that are financial, and that are even connected to areas like purpose. And so as we think about this effort, we're thinking about how we can leverage this partnership to predict, personalize, prevent, and promote health and wellness. I think if you look at, as you mentioned, the history of IBM, it's always been at the forefront of this idea of humans and computers together. The first IBM systems were systems that counted, the census. And actually, IBM was very integral in the Social Security Administration, the enrollment of Social Security, 26 million lives at that time. I mean, this had never been done before. There were computers, in fact, we assisted the computers that helped bring people to the moon. If you see, there's some amazing footage that you see the role of those computers and IBMers, to support the lunar landing. And so we've always been about this idea of humans and computers together, and we call this now cognitive. And we reference Watson, which is a system that understands, reasons, and learns. And it is about what we call augmented intelligence. It is about the recognition in healthcare that it's humanly impossible for any doctor, any patient to know everything about everyone that they see. And how can we provide a translation of that data into an insight at the key decision points, the workflows, the think flows that people have in order to improve healthcare outcomes and provide value and transformation in the health system. And so this is just another part of that journey that, frankly, we've been on for a long time.